My name is Lucero, and the title of my article is Emergency Nurses' Attitude Towards Barcode Medication Administration. Two stated goals or purposes of this research study is to identify emergency nurses' attitude towards the acceptance of this technology, and we also want to understand nurses' attitude on barcode medication administration in the emergency department that may assist in creating implementation strategies that will improve medication administration to process turnaround time and remove barriers to ensure increased compliance and improve patient safety. Summary, or what's already known prior to the research study, is that barcode medication administration is designed to reduce medication errors, but it heavily depends on the nurse's willingness to use it properly. Using barcode medication administration can decrease medication errors up to 90 to 90.4%. But barcode medication administration is the gold standard of medication administration. Although nurses must accept it and use it appropriately, some adverse effects associated with medication administration were among the primary cause of harm and resulted in additional days admitted and increased costs in the patient's medical bill. The acceptance of barcode medication administration improved the nurse's job performance, increased effectiveness, and improved patient and medication identification. Although nurses find barcode medication administration to be time-consuming, they also acknowledge it to be the safest process for their patients. Approximately 34% of medication error occur during the administration phase. This also ensures the 5 rights of medication administrations are being followed. That includes the right patient, the right medication, right route, right dose, and right time. Leadership support is paramount to successfully implement the consistent use of barcode medication administration. Some leadership roles could be your charge nurse or management, and it is important that they give you the right resources to be able to use this barcode administration and also the training. It is very important to have both of those to have consistent use of it. Why it is necessary or important to conduct the current research? Number one is patient safety and reducing medication errors. There are major concerns in the emergency department due to the fast-paced environment. This research shows how emergency department perceive the barcode medication administration and identifies barriers to implement the usage of this technology. There is also a lack of research focusing on the emergency department nurses in critical care environments where medication safety is crucial. Most patients come in critical condition, so adding on top of their condition, medication error can be fatal for these patients. Discussion of methods used to include in this research is the quantitative descriptive research. This uses numerical data used to describe characteristics, or in this case, the nurse's attitude, using the barcode medication administration. For study subjects, the researchers had 55 emergency department nurses in the survey. So 70.9% of nurses had 5 years or more experience in the emergency department, and out of those 55, 2/3 had 1 year or more experience with the barcode medication administration. So 1 year is not a lot of experience for most. For the age, it's 31 to 50-year-olds. Majority is 34 or older. And for the gender, it was 90.9% females and the rest is male. So procedures used to obtain this data: cross-sectional survey design. That is data collected over one specific point in time. And we also had the emergency nurses who use barcode medication administration technology as part of their current workflow. Materials or measurement devices for data collection. It is the Unified Theory of Acceptance and Use of Technology, UTAUT questionnaire. And so step-by-step description of how the research was conducted. The researchers used convenience sampling to recruit participants, and nurses volunteered based on their availability and willingness. Convenient sampling is just the nurses who received the email. It was over SurveyMonkey, I believe, and it was it was just nurses who were willing to able to do their survey. And it was made to explore the emergency nurses' attitude towards the use of barcode medication administration in their clinical setting in the emergency department. And it helps to assess how the barcode medication administration is recognized in terms of safety, workflow efficiency, and user satisfaction, user being the nurse. And it was only included in the emergency department at selected hospitals and also emergency department nurses with barcode medication experience and active use of this technology. So procedures used for data analysis, they use the descriptive statistics such as means, proportions, and percentages towards the AUT questionnaire, the one I described up above. And so for research results and findings, so the emergency nurses had mixed to moderately positive attitude towards barcode medication administration. Many nurses did acknowledge that barcode medication administration improves patient safety by reducing medication errors. That comes in with the 5 rights. They're able to touch up on all of those bases and ensure that it is the right patient and right medication. Researchers' conclusion. So for conclusion, emergency nurses had mainly positive attitude towards barcode medication administration and recognized that it did improve medication safety and reduce errors. We won't administer medication, but we will use barcodes to receive in our patient samples. I know that can eventually lead to medication administration. Like, for example, if we were to scan a patient with normal potassium levels, but we drew another patient's blood and they had low potassium, but we associated that with the patient that had normal potassium, it could eventually lead to the patient receiving more potassium than they needed. And we know that potassium can affect the heart. And then could lead to cardiac arrest and maybe death. So that is where some roles as techs, it is very important that we also identify our patients as well. As well for blood bank administration, in the lab, they are very particular about how they do things. They can reject samples if they think that you overrode scanning your patient. I've had that happen. As working in the lab, we did not take any samples that were not scanned. That the nurses didn't scan the patient's wristband. That shows us or tells us that the nurse didn't use their 5 rights to identify that patient. So for safety measures, we want to scan our patients. So for research weaknesses or potential biases that could affect results, the study was self-reported and could have response biases, and the nurses could choose their desirable answer. Like the example that I just said, the nurses would want to pick the correct answer, and that could affect results. The study did not track actual error rates, so the nurse's attitude did not correlate with real-world outcomes. The research cannot track change in attitude over time since it is a descriptive and cross-sectional. It does not allow to track attitude over time and cannot establish causation of positive or negative attitude. I know in order for us to track attitude over time or anything over time, then this research has to be done multiple times over the span of a year or multiple years, depending on how the researchers want to, however they want that trend to go. This just needs to be done several times again, over and over